This is a public health announcement. Brought to you by Heather Shepard.
The Primal Pioneer. Live an outdoor life.
This is the Primal Pioneer podcast, a show dedicated to helping you achieve optimal health by making radical lifestyle, dietary, and environmental shifts to support forward movement with your health. I'm your host, Heather Shepard, radical health practitioner, gut health specialist, and homeopathic doctor in training. When I was 23 years old, I suffered a TBI, otherwise known as a traumatic brain injury. This shifted my life from being a super athletic type A kind of person to being completely sidelined from physical activity for nearly 12 years. During this time, I tried every modality under the sun, desperately yearning, trying, and hoping to get better. It wasn't until I stepped outside of the conventional medical model and even much the alternative medical model that I saw real lasting progress with my health. Today, I help thousands of people overcome both acute and chronic ailments using my nature and science-based radical approach to health, which targets the most important yet most overlooked aspects of our health and well-being. Today's episode is all about skin eruptions. What do they mean with regard to your health and body? How can you approach them in ways that enhance health versus suppress health? I also talk about how skin eruptions are an important part of health, and I discuss the importance of getting acutes, such as colds, flus, and fevers when it comes to preventing chronic diseases like cancer. Enjoy. Hi everyone, welcome back to the Primal Pioneer. Today, I'm excited to connect with you all about skin eruptions. I mentioned in the last episode that we were going to be touching upon this topic in this episode. And so if you're someone out there who struggles with skin eruptions, eczema, psoriasis, bumps, things on your skin that itch, that are uncomfortable, that are concerning to you, this episode will likely help to shed some new light and life on skin eruptions and how to approach them in a proactive way and why they're actually occurring in your body too. We'll get into that as well. And then throughout the episode, I also talk about acute conditions, the immune system, and why it's actually an important part of health to get acutes. And what I mean by acute is a cold, a flu, a fever. So let's talk about skin eruptions because typically this is a sign that the pathology in your body is expressing itself in a safe way. Okay, what do I mean by this? I mean that this is a way that is protecting you, is protecting your health. It's an attempt of your defense mechanism, aka your immune system, to prevent the pathology from going deeper into your body. So it's preventing it from going to more life-threatening organs. So when something's coming out of the skin, typically this is a protective mechanism of your body to protect other more life-threatening organs. Of course, there are different variations of skin eruptions, okay? So we have some more, I want to say, less concerning issues such as acne, eczema, psoriasis, wounds, things that scab and pus. I know that might sound disgusting, but just trying to be real because a lot of people go through skin stuff. And then we have some more advanced conditions where these are more life-threatening. There's conditions where the skin, the sheath over the skin literally is peeling away, and that's actually a very dangerous condition with a super low life expectancy, and can be life-threatening. So throughout this episode, I want you to know that I'm mostly referring to skin eruptions that are not life-threatening. Okay. So this is things like acne, eczema, those scabs that itch, bumps on the skin, inflammation at the skin level. And this is for adults or kids, right? Okay. So I know kids often get skin issues, and this is a very important part of the immune system of the child developing its immune system. And this is a key point right here. If your child is getting a skin eruption, the very best thing that you can do for your child is to not suppress the eruption, because the more you suppress in childhood, the worse their immune system is going to be later in life. And you'll learn more here throughout this episode, but I really want to make this point because us adults would be a lot healthier if our parents actually allowed the skin eruptions we had as children to come out without suppressing them with these friggin' nonsense ointments and antibiotics and steroid creams, etc., that actually push the pathology deeper into our body and suppress the immune system. And so that when we get older, we can't get fevers, we can't get acutes because our immune system has been so shut down. So let's deep dive into this and take a look at our common conventional approach to skin eruptions and skin ailments. And then I'm going to talk a little bit about the other approach, which is the approach that I highly recommend, is the homeopathic approach to skin eruptions. So the goal is, after you're done listening to this episode, we're only taught, hey, you have a skin eruption, put some corticosteroids on it, get some antibiotic cream and put on it, right? So the goal of this episode is to teach you there is another way. There are other ways to approach your skin eruptions that actually help to facilitate health and healing. So let's talk about the conventional approach to skin issues. It's all based on suppression. You all have heard me say this time and time again if you've been listening to the podcast up until this point. So namely, conventional medicine tends to approach skin eruptions. Literally, you walk into your doctor, oh, you have something on the skin, bang, 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 here's a script for your corticosteroid cream, go get it, fill it, apply this stuff however often you want. Just put it on the skin. No harm done. Here you go. Just keep applying it and we're off. However, corticosteroids are among the most dangerous medicines out there today. Of course, statin drugs, are high up on my list as well, but corticosteroids, they are a big no-no. Like really, unless you're about to die, you probably really want to avoid corticosteroids and seek out some alternate routes. Particularly homeopathy can be really, really, really effective. So the main reasons as to why I'm not a fan of corticosteroids, of course, this is not medical advice. You have to do what you're called to and etc. This is just what I would do if I were in a situation and I went into my doctor and I said, oh, I have this rash on my arm and it won't go away and it's itchy and it's just really bothering me. So, and they give me corticosteroids, I'd be like, yeah, throw that in the trash immediately, that script. So why I'm not a big fan is because they suppress symptoms to a very large degree. So literally you apply the ointment, the thing goes away almost like immediately. The skin eruption, it really starts to go away pretty quickly. And then we're like, yay, the skin eruption's going away. I'm feeling so much better. That's so great. But what we don't know is that corticosteroid has just pushed the pathology that your skin, this is the way your defense mechanism is acting. It's trying to push the pathology out through your skin. So it's really trying to move that pathogen out through the skin to prevent it from going to a deeper layer in your body, because when it gets to a deeper layer in your body, you'll get a new set of symptoms or later on, the skin eruptions will come back. And so then we're like, oh man, I thought I healed that. I thought I dealt with that. But no, when we suppress, we actually don't deal with it at all. It's just like putting, a blanket over a bonfire. So corticosteroids are very suppressive. Just because your symptoms go away doesn't mean you've been cured. And I know we've been taught the opposite. Number 2, corticosteroids destroy the hormone and metabolic signaling in your body. I just launched the Metabolic Reset course, which was really, really awesome and a big success, and I'm very happy how that went. I want to mention, however, that when people start that program, I am very keen to mention, if anyone's on steroids, corticosteroids, etc., this program will not work effectively unless you make an effort to work with your physician to get off of those medications, because they absolutely destroy metabolic and hormone signaling. Your body gets very confused, very chaotic, very inflamed as a result of using those drugs. Okay? So again, people get really, they tend to experience relief after they take the steroids because their symptoms disappear. But the thing is, the symptoms don't actually disappear. They just get pushed down deeper into the body, causing a more chronic, a more diminished state of health. And most people look to corticosteroids when they have a skin issue. Usually a skin issue that lingers because they get sick of itching or looking at it, or they get self-conscious about what people are going to think or say about them. However, if it's me with something like that, even if my face was like filled with, something unpleasant and I was so embarrassed about, going to corticosteroids would be the very last resort that I would go to. And for many reasons, those are some that I listed there for you all. So let's talk about when something comes out of the skin, okay? What does it mean? What does it look like? How do we approach it? How do we not suppress skin eruptions, pus comes out of the skin, itching, eczema, right? We actually want to encourage it to come out. We don't want to push it back down with the steroids, corticosteroids. We don't want to push it down with antibiotic creams. We don't want to put on any medicated lotions. We don't even want to put things on like Bath and Body Works or that scented like stuff that is really toxic to the body. We don't want to apply that to the skin eruptions. It's going to be, it's going to suppress them. Okay. We want the pathology to literally come out, okay? And if you don't encourage it to come out, it's going to come back and bite you in the booty later down the road in the form of a more chronic condition. So rule number 1 when it comes to skin eruptions is let it run its course, okay? Super, super important. If it gets so intense that you have to act and do something, my suggestion, what I would do, first look to homeopathic care, and here's why. When your body is battling a condition, okay, let's say a common cold, a fever, a rash, a skin eruption, etc., and you can't seem to get over the hump with it, right? You keep bumping up against it. It lasts forever, or it goes away and then it comes back, or it goes away and it comes back, right? It can't seem to really... You can't seem to get over that hump, okay? It's still present. It's bothering you. It's becoming a nuisance. The reason why you can't get over the hump is because your defense system isn't strong enough to actually push the disease out of your body. It's not strong enough to push the disease up another level. So it's having trouble removing the disease because your immune system simply isn't strong enough to get you over the hump. Now, conventional medicine suppresses. We know that. I talk about that 100% of the time. It's suppression. And while we feel like we might be over the hump because we apply the corticosteroids or the antibiotic cream and there it's gone, and we think that it's not there anymore, we literally just push the pathogen to a deeper layer. So when we do this, we suppress the defense system even more. So what happens is the next time you bump up against something in your body, a pathogen, a toxin, your immune system is going to be weaker and have an even more difficult time when it has to fight back again. So I also want to mention that after you take things like antibiotics, corticosteroids, etc., there are side effects that point to a diminished state of health. So meaning after you've taken the antibiotics, after you've taken the corticosteroids, your body will start to produce symptoms that show your health has actually not improved, but your health has actually gone down a notch or two or several. So this is why like people after they take rounds of antibiotics or corticosteroids, they're fatigued, they're exhausted, their blood pressure becomes irregular, they get gout, they get depressed, they get edema, they have blood sugar issues, they have anxiety, right? The list goes on and on and on. These are not signs that your body's actually getting better. It's not signs that you've been cured. These are actually core signs that your health has been diminished. So with conventional medicine, the symptoms might go away when you start taking the meds, but this doesn't mean that you're healing. Quite the opposite, actually, because allopathic medicine cannot cure, it only suppresses. It's just the nature of their medicine. And again, this isn't saying, never use conventional medicine, because there are times where it can be absolutely life-saving. So let's talk about how homeopathy is different. And I'm going to give a specific example here regarding skin eruptions. So let's say that someone has a skin eruption, right? They have eczema that itches. It itches really bad. It's worse by the heat of the bed. So they lay in bed and they get really hot and maybe a little sweaty, and they have to put their feet out of the bed. And when the rash or the eczema gets agitated by heat, it's worse with bathing. The patient itches the eczema until it bleeds. The patient also has fear of heights and fear of seeing people in high places. The patient's just in general typically hot and aggravated by heat. They have a big thirst, okay? I'm giving you all of these details here so you can see that we're not just treating a skin eruption here, we're actually treating a person, right? Because if you go to your doctor, your conventional doctor, you're like, I got a skin eruption. Even a lot of, alternative doctors, NDs, they're going to be like, oh, you have a skin eruption. Put this ointment on it. And of course, it might not be toxic. It might be non-toxic, right? Especially if you're going to an ND. But what are we really treating? What are we really doing here? We need to treat the person and all the totality of the symptoms that are presenting, and not just the physical symptoms, because you might present with, you see this case I just gave you here. This is a typical sulfur case, okay? Sulfur is a very common remedy to prescribe for skin eruptions, but there are literally hundreds of other remedies for skin eruptions. It depends on how the skin eruption is acting as to what you actually prescribe. So this isn't like a cut and paste Google, like how to get rid of skin eruptions. What do I do? We have to look at the whole patient if we really want to lead the patient to their own cure or improved state of health. Okay? And to do this, we can't just Google like skin rash that itches. No, we have to take all of these things into consideration so we can get the patient the remedy that is going to act in a positive direction for them. And by a positive direction, I mean after they take the remedy, they actually feel better. So unlike conventional medicine, we see the health go down a notch. They get fatigued, they get depressed, they get anxious, etc., right? Well, in homeopathy, after you've taken a remedy, if you've been given the correct remedy, you should literally feel better. You have more energy. You just feel generally an overall improved sense of well-being, right? These are very important things to consider. And it's important to note that just because you have a skin eruption doesn't mean you need the same treatment as, your sister down the street who has a skin eruption and your coworker who has a skin eruption. They probably most likely will need a different remedy depending on their physical, their mental, and their emotional symptoms. This is a huge difference between homeopathy and conventional medicine, is that it's looking at the totality of the patient. It's not just saying, oh, you have eczema, take corticosteroids. It's saying, whoa, okay, let's take a look at the whole picture here so we can get you the right remedy. When we get somebody the right remedy, they have the ability to improve their state of health. This is the goal of homeopathy, of classical homeopathy anyway, is that you want to improve your state of health. Not just, remove the eczema, but literally feel better in all aspects of your physical, mental, and emotional well-being. So this is really, really important to keep in mind, because if you're someone out there who's into homeopathy and you've tried Googling things for how to get rid of your skin eruptions or your kid's skin eruptions, it's really, really important to not just take the physical into play, because that's not going to get us very far. Typically, maybe 1 or 2 times out of 10, we'll find the right remedy by Googling something that's probably kind of high. Because we really need to take into consideration, what's the mental, emotional health like? What are their phobias? These are going to point us in the direction of the correct remedy for the patient. So this is one way homeopathy is different than conventional medicine. Also, when you give the right remedy in the correct dosage, okay, this is another thing is why homeopathy is a great medicine. It's really great, but there's a lot to know about it to really grasp how to use it in an effective way. So one, we need to get the correct remedy to people, and to do so, we cannot just take the physical symptoms into play. We need to take the totality of the person, the essence of the person. We need to take all of these things into play. Physical, mental, emotional, phobias, all of that needs to go into play. Okay? So that is very huge. And then we have to give them the right remedy in the correct dosage. Typically, for people who are struggling with physical ailments only, which is rare, most people are going to have some sort of mental, emotional thing going on as well as the physical thing that they're experiencing, right? But sometimes, once in a while, I'll get a patient who has purely physical symptoms. And so when we get that, no matter who we're treating, we need to be sure we give the correct dosage. Typically, if there's just physical symptoms, the potency, meaning is it a 9C, a 12C, a 30C, a 200C, 500C? Is it a 1M? Is it a 10M? Is it a 50M? Etc., right? So if there's, just physical symptoms, the potency tends to be lower. The more intense the mental emotional symptoms, typically the higher the potency we need to give. So there's a lot of factors to take into play when you're prescribing homeopathy in an effective way. Also, a big differing factor between homeopathy and conventional medicine is that homeopathy is based on the law of similars. Like cures like, right? So you give a remedy that produces similar symptoms as to what the patient is suffering from. And we know this in the world of homeopathy based on something called provings. You give a remedy to a healthy individual, and then they start to experience symptoms. This is called a proving, and this is how we understand and detect how a remedy will act in somebody. So if you give sulfur to a healthy individual and they start getting skin eruptions that are made worse by bathing, and they have really strong sweat that stinks, and they have diarrhea first thing in the morning, this is how we know how sulfur will act in the body. So you will give that remedy, sulfur, to individuals who express those symptoms. This is the law of similar, giving a remedy that produces the same symptoms as the patient is having. Okay? Now, this is exactly the opposite as to how conventional medicine approaches. They approach with basically the law of opposites. Okay? So for example, if someone is constipated, you give a laxative. But this approach never gets to the root of the issue. It never removes the underlying cause. Using the law of similars does help to remove the underlying cause when you give it in the right potency, in the right dosage, and you have the right remedy. So there is a lot of potential for huge health benefits when you use homeopathy in the correct way. And this is why homeopathy is so effective, because it helps produce symptoms in the body that the patient is struggling with. And you're like, well, why would I want to do that? And so I'm going to get into that because this is a really good question that people often ask. So hold that thought right there. If you're searching for deeper healing, I'd love to help you get there. Whether you're struggling with a chronic health condition, maybe a condition that Western medicine has no effective treatment methods for, maybe a condition that other practitioners are having trouble pinpointing, or if you're struggling with an acute ailment, a cold, a flu, a cough, even pneumonia, bronchitis, seasonal allergies, then I invite you to set up a homeopathic consultation with me. To do so, you can contact me at heather.shepherd@gmail.com, and that's spelled HEATHAR.shepherd, SHEPARD@gmail.com, or head over to my site, heathershepherd.com, and book a session to start accessing root causes of your health struggles and to start improving your level of health. Now, let's head back to the episode all about skin eruptions and the importance of acutes. Let's just say, for example, when you give the correct remedy in the correct dosage, so say for the case I gave you here, we give sulfur 200C for the skin eruption case. What happens is the patient will initially experience heightened symptoms, okay? And this is here where we're tying in, why would you give a similar remedy that produces similar symptoms as to what the patient is having? Because the immune system isn't strong enough to get over the hump. It's not strong enough to actually push the pathogen out of the body. So we give something that's going to create similar symptoms. So initially, after you take the homeopathic remedy, your body creates more of those symptoms initially in the short term, allowing your immune system and your defense system to push the pathogen out of the body. So this is why so commonly and so frequently you give sulfur to the person who needs sulfur, right? And initially they start to itch more. They have more itching on their skin. If you give it for a skin eruption, then they start to itch more. Well, that's a great sign. Sulfur will make you itch more. It will bring out the skin eruption because it's stimulating your defense mechanism to produce more of those symptoms, because your body wasn't strong enough to produce those symptoms on its own. It needed a helper. Sulfur was the helper in this case, came in, you get more itching for 1, 2, 3 days, and then eventually you see, oh wow, the skin eruptions are cleared. I have more energy. I'm not depressed. I'm sleeping better. I'm not waking up every hour of the night. I'm not sweating at night, etc. Okay? So this is very, very huge. It's completely opposite to conventional medicine, right? You give them the same treatment to every single person, and the pathology gets pushed down deeper and people feel worse. Homeopathy, you give a unique remedy, literally thousands to choose from. You give a unique remedy to the patient. A sign that you've given the correct remedy is that initially they'll have an aggravation from the remedy. Let's take the sulfur case, for example. for a skin eruption, it gets a little bit worse for a few days, and then it starts to clear, okay? And then they start to feel better. When you give the correct remedy in the correct dosage, it has the unique and powerful ability to change the state of health from a lower state and improving it to a higher state of health, which is exactly what we want. That is the goal of homeopathy. So, I'm going to say 4 big common mistakes that I see in homeopathy. Number 1 is giving the wrong remedy in the wrong dose. That's kind of like 2 right there. But you're just giving a remedy for symptoms in the wrong dosage. Number 2, you give a remedy repeatedly. Oh my, this is something I see all the time. Oh, here's this, take this every day, take pulsatilla, 200C every day for 7 weeks. This is typically not how to use homeopathy effectively or correctly. Typically, you do not repeat the dosage unless there are certain circumstances where you might need to repeat the dose. If something's been antidoted, if the patient is actually on some kind of prescription drug and they're weaning themselves off, then you might need to repeat the dose on a regular basis. If the person is elderly and can't handle a high dose because they're not strong enough to, it'll be too stimulating for them. For example, you rarely give somebody over 70 higher than a 1M because they're typically not strong enough. And that's not like written in stone, right? This is just general. You don't want to repeat the remedy, only in certain circumstances. So when you would want to repeat the remedy, let's say you see an improvement initially with a low dose. Let's say you gave that sulfur patient 200C. They got better for 3 days, for 5 days, 7 days. And then it started to come back a little bit, but initially you saw a really, really good reaction. Then you might want to either repeat the dose or repeat it in a higher potency. You shouldn't have to do that more than once in a case like that. Repeating the remedy over and over, it doesn't allow the immune system to react in a positive way. You're continuously giving it signals. Homeopathy, you only need 1 dose. In most cases, you only need to give 1 dose. So, this is mind-blowing to many people. When I work with someone doing homeopathy, and you're like, wait, Heather, I got the remedy in the mail, but there was only 10 pellets. I was like, yes, exactly. There's only 10 pellets. Just take 1 dose. That's all you need. Of course, there are some exceptions, but typically it's all about 1 dose. You need to let your body, your immune system react, have the space to react, let it react to that remedy. If we keep giving the same remedy, you will likely just create a proving. For those of you who are familiar with homeopathy, you'll know what that means, but you'll basically just start to prove the remedy, and then it will become ineffective. Number 3, combo remedies. Don't give combo remedies. What is a combo remedy? Oh, arnica plus bryonia, etc. Okay, there's just 100. Not 100, but there's just a lot of different remedies in 1 tablet, in 1 dose. Don't want to take combo remedies. Combo remedies, this is impossible to actually diagnose correctly because it uses multiple remedies which have different effects. When we're diagnosing, when we're making a diagnosis as to what remedy to administer and to suggest, we need to hone in on which remedy is the body needing, which remedy is the body expressing. Giving a combination remedy, there's too much going on in each remedy, and when your body takes that, a lot of different things happen. One is that the body gets very confused. I've seen it diminish the state of health. So actually the state of health will go down. I've seen people get very fatigued after taking combination remedies. Remember that we have to diagnose in homeopathy based on the law of similars. So you need to seek to find the closest remedy that has produced similar symptoms in the healthy patient, right? Through the provings. So to actually bring the patient towards a cure, you have to find a remedy that has a similar totality of symptoms. This is why we cannot just use mixes of remedies, because we'll never get the individual towards a state of cure. It's very confusing to the body. It actually diminishes the state of health, causes fatigue, and Hahnemann talks about this in the Organon. So this is a classical homeopathy approach. Do not combine remedies. It is not effective. Even if your symptoms go away, they will come back. The idea with a one dose, giving the correct dose, giving the correct remedy, is that the symptoms will not come back unless, number 4, you antidote the remedy. So a common mistake I see is that people are not informed as to what actually antidotes the remedy. Coffee, we know, antidotes remedies. Decaf isn't said to antidote remedies, but caffeinated coffee as shown to antidote remedies. Mint, a lot of people are scared of mint. However, it's been shown that mint does not actually antidote remedies unless you're taking nat mur. Other remedies, just avoid mint. I tell my clients, hey, just to be safe, avoid mint for a week after you've taken your remedy. Unless they're taking nat mur, then I tell them, hey, you can't have mint for a long while. Other things that antidote the remedy are CBD or cannabis. I'm not a big fan of these things. That's for a different episode. These are they're based on symptom suppression, basically. And it's not because I don't encourage plant medicine. I love plant medicine, but cannabis and CBD, I've seen it do much more harm than good on the body. Also stress. So if you're exposed to stress, let's say you've taken the correct remedy, it's correct, you're seeing improvements. 4 months into it, you have a big stress, and then all your symptoms come back. This is when you want to revisit either the remedy or do another intake. Those things can antidote. So really keep those in mind when you're looking to exploring homeopathy. With skin eruptions, let it run its course. Do not suppress. These are my suggestions. Seek out homeopathic care that helps to move the body in the direction of its own cure. And this is because if you can push the pathology out through the skin, your health will improve a level. And this is what we want. Unlike conventional medicine, right? We get the groggy, we get the fatigue, we get the depressed, we get anxiety, we get cancer after prescription drugs. Homeopathy, you'll feel better. Your mood, your energy, your sleep will all feel better. This is because your level of health is actually improving. Now, if you give a remedy for a non-skin related issue and the patient develops a skin issue, let's say, for example, I just gave a patient phosphorus 50M. Okay, this was a big remedy. It was a big remedy. Lots of stuff going on for this patient. Did she start initially with any skin issues? No, she did not, but she developed acne afterwards that she had as a teenager. What she's concerned about this, am I concerned? I am not. I say this is absolutely an amazing sign. It's telling me that the remedy is acting in a very positive direction, because if you get a skin eruption after you take a remedy, and this could be any skin eruption on any part of the body, okay? Any part of the body, back, face, arms, abdomen, genitalia, you name it, skin eruption after remedy, positive sign. It says that the body's actually pushing out the pathology and moving to an increased state of health. So when this kind of skin eruption happens, do not treat these eruptions with another remedy. You will stop the action of the remedy you just gave, which is acting positively. And we don't want to do that. We want it to continue to play out. Now, unless, of course, the disease, the pathology, the eruption becomes life-threatening, then of course we need to interact. We need to take action, okay? So if it's not some intense life or death, life-threatening skin eruption, let it come out in these cases. It's a positive sign your body's improving a state of health, okay? Now, most people don't want to experience symptoms. We're taught that symptoms are a pain in the ass. We just want to continue with our day. They're a hassle. They take away from our routine and our schedule. But I'm going to be honest, if we modern people want to heal, we need to get acutes. We need to get acute sicknesses, cold, flus, fevers. We need to get these things if we want to be well. You might be thinking, Heather, this sounds absolutely insane and counterintuitive, and it makes no sense to most people. I totally understand. Most people, we're not taught that being sick is part of health. Okay, just look at the state we're in right now. People are scared to death of a flu. Okay, and people who are immunocompromised, that's a whole nother story that I'll get into here in just a minute, because there's more to say about this. But first, I want to help you grasp this importance of getting acute sicknesses. Because you have an immune system for a reason. If you don't use it, you lose it. So I've been seeing cancer patients for around 12 years now, okay? And literally over 90% of these patients that I've worked with have never been sick, or meaning like acute sickness. They say, I say, when's the last time you've been sick? Tell me about that. Have you been sick a lot in your life? How often do you get sick? Oh, I never get sick. I was never sick. I can't believe I got cancer. It came out of nowhere. I can't remember being sick for years. I can't remember when I got a fever last. And then someone say, I got a fever of 99, 100. No, that's not a fever. I'm talking 103 or higher. That's a fever, right? So when we see this today, or I should say we never see this today. People don't get fevers of 103 or higher. People don't get acutes that often unless they're kids. Kids more often get acutes because this is an important way that their immune system is building themselves. It's building itself. It's strengthening itself. Okay. So, for the past, 150 plus years, our approach to health has been based on suppression. Vaccines, antibiotics, prescriptions, etc. And using this approach, we've literally turned off our immune system and the way it responds to our environment. Then one day suddenly we're stunned because we have a cancer diagnosis. Cancer is a result of an inactivated, underactivated, underused, and suppressed immune system. For us to be healthy, we have to have fevers, we have to have colds, we have to have flus, kids and adults, okay? We did not get cancer until we started to suppress our immune system with vaccines and antibiotics. So then we stopped getting in acutes, okay? We stopped getting acutes. When we stopped getting acutes, then we started getting cancer and chronic diseases. We need to get acutes if we want to be healthy. Homeopathy is like taking your immune system to the gym because it gives you this opportunity to improve your level of health, to cleanse all of that crap that's been pushed down with the corticosteroids and the antibiotics and the vaccines. These things need to come back out. So we can't expect to be healthy without getting symptoms, without these symptoms coming back out of our body. Even though you might not feel them right now in this minute, get yourself some treatment, some care, because the last thing I'd want you to do is, I haven't gotten an acute in years, and now 5 years from now, you're like, I got a cancer diagnosis and I haven't been sick. Address what you're going through right now before you get to that point. Seek out an experienced classical homeopath to help you shed these layers. I cannot emphasize this enough. It's going to be one of our keys to improving our health and to keeping our youth healthy. So I cannot emphasize this enough, because it's one medicine that literally helps to improve our immune system. It helps to rid our body of all those pathogens that have been suppressed by the corticosteroids, by the antibiotics, by the vaccines, okay? So we really need to encourage acute conditions, right? There really is something to the herd immunity. There is a lot to this, because our culture, we're based on suppression. Our emotions are suppressed. Our physical health is suppressed. And this is all why this suppression, we're scared to get sick. We're afraid that something bad will happen to us. But we need to get sick. We need to get acutes. And I'm not telling you we need to get sick like cancer, diabetes, etc. When I say that, I mean we need to get acutes so we can stay healthy. It's literally like taking your car to the gym. It's literally like taking your immune system to the gym. Right now, this is what I was saying before I got into this whole thing, is that there's so much nonsense and fear-mongering going on around COVID that it's absolutely ridiculous. We're training our society to fear acutes, right? We're afraid to get an acute. And when we suppress acutes, then we end up with a chronic disease like cancer real quick. And not to mention, I'm not going to get into COVID that much during this episode, but the testing is faulty. You know, I've heard people come to me and say, Heather, my husband and some of his friends at work went to go get in line to get tested for COVID. It took so long to get tested. They left. They went back to work. They got a call, a few hours later saying, hey, you tested positive for COVID. It's absolute fear-mongering what's going on right now, and it's pushing us all towards an agenda of one vaccine, okay? Which is one of the biggest suppressive medicines out there today. If we even want to call that a medicine, it's a pure toxin. It has nothing to do with health or preventing illness. Vaccines are a huge underlying cause of our chronic illnesses today. And I just want to mention, I know that the media and the news and that people say, oh, people are dying from COVID. People die from the flu. People die from cancer. People die from getting hit by a car. The test that they're using for COVID is faulty. The treatment that they're using is also faulty. It's based on suppression. And when they've used ventilators in the past, I've literally had patients say, my mom got diagnosed with COVID, took her into the hospital, they put her on a ventilator, she died in 24 hours. You cannot just give a ventilator to anyone, people. Just because somebody has a breathing issue, you cannot put them on a ventilator, because this alters oxygen levels in the body, and the body is very sensitive to specific oxygen levels. The treatment is literally killing people more than the disease. So we have to use common sense here. There's no reason to be afraid of COVID, a flu, an acute, a fever. We need these things. Our bodies rely on them. They need these things in order to prevent diseases like cancer. So if you're someone with a compromised immune system, then take initiative right now to see a classical homeopath, to take measures to improve your immune system by getting your Sunlight RX on, by eating the metabolic reset diet, by getting healthy fats into your diet. Okay? These things are going to help you. There's a lot that you can do to help get your immune system into a healthier place. We're not victims. There's a lot we can do to support our health. And our immune systems right now, they're super suppressed. They're very suppressed by antibiotics, by vaccines, and we have another vaccine coming out that's going to be a real, we're going to see a lot of health issues from this vaccine. We're going to see health issues that we've never seen before because of the nature of this vaccine and what's in it and how it's linked into the smart grid It's no joke. I wouldn't recommend it to anybody. It's no joke. You want to get acutes. Do not be afraid of COVID or other acutes. The fear-mongering out there, it's what's keeping people small. It's keeping people powerless. It's keeping people's immune systems suppressed. It's further fueling our immunocompromised society and world. So, moral of the story here, here's the take home. Skin eruptions. Let them come out. Don't suppress them. Look to homeopathy, classical homeopathy. And acutes are your friend. They prevent cancer. See you next time. Thanks so much to all of you who tuned into the episode today, all about skin eruptions and acutes. For years, I thought that getting an acute was bad and that it meant I wasn't healthy. I grew up applying gobs of antibiotic creams to my face for acne because I thought this was what my body needed to get well. We've all been trained to think of health and healing in ways that are actually counterproductive to true, authentic health. Now, it's time to unlearn all the garbage we've been taught about health and healing and relearn what health and healing really, really look like and entail. And I hope that this episode helped to bring new insight, knowledge, and empowerment along your path to health. For those of you who enjoyed this episode, I would love for you to post a 5-star review with your comments and support. This is such an amazing way to fuel and motivate my continued podcasting and sharing via this platform. And it's an awesome way to help spread the word to others searching for deeper answers around their health. I thank you so much for that support. As always, you can follow me on Instagram at sunlight_RX or on Facebook, Heather Shepherd, HeatharShepard, and visit me on my site, heathershepherd.com, where my metabolic reset course, recipes, and radical health blog, including seasonal recipe info, are all located. Keep up the awesome healing work, everyone, and we'll see you next time. The Primal Pioneer podcast is not intended to diagnose, treat, or cure any disease in the Western medical sense or terms. It is to be used for educational and informational purposes only. The information shared on this podcast and all of Heather Shepherd's work is not a form of diagnostic medicine, nor is it a medical treatment. Heather Shepherd is a health educator, radical health practitioner, and a trained EMF specialist. And although she has a bachelor's in science and master's education in alternative medicine, she is not a medical doctor and does not give medical advice. Her work and sharing is to be used for informational and educational purposes only.